Welcome back to the Simplify Senior Transitions podcast, a show where we explore real stories, expert advice, and trusted resources to help families confidently navigate senior living, caregiving, and everything in between. I'm your host, Dale Corpus, a senior transition specialist and real estate expert based in the San Francisco Bay Area. I'm also part of the sandwich generation, just like many of you, juggling a career, raising kids, and figuring out care options for my own aging parents. That's exactly why I started this podcast, because finding the right answers for senior care can feel overwhelming, fragmented, and confusing. I wanted to create a central place for families to find the resources they need to make informed decisions. Today's episode is all about home health care and how the right support after a hospital stay can make all the difference. Joining me is Alvin Mojica, CEO and managing partner of Triage Home Health. Alvin is a powerhouse in this space, blending medical expertise, patient advocacy, and heart-centered leadership to help seniors safely age in place with dignity and confidence. In this episode, we're diving into what families should know about home health care services, how Alvin's team bridges the gap between hospital and home, common myths about home health and the real facts you need to know, how the right care plan can prevent rehospitalizations and boost quality of life. Let's dive in.
Welcome to the Simplify Senior Transitions podcast, where we help families navigate senior living, real estate, and everything in between. Hosted by Senior Transition Specialist Dale Corpus, this show brings you expert insights, real solutions, and stress-free strategies to make senior transitions simple. Ready to dive in? Let's go.
Okay, and we're back, everybody. Alvin, thanks so much for being a guest on today's podcast. How are you today?
I'm great. Thank you for having me here.
So, Alvin, tell us a little bit about your background and what inspired you to get into the home health care space.
My background has always been business with a focus in Valley technology.
Yeah.
You ask me anything about computers, networking, services, and products, I know about those products. And I got into this business because of my mom. You know, when my mother got ill, she had kidney liver disease. And when I did not know anything about this industry when she was going through her journey, I got lucky because I had two sisters who happened to be the care provider for them, and one of them were going to healthcare industry.
Yep.
But what dawned on me over the last year of her before she passed was I got more involved, but I didn't really know what entails of what services she has, what diseases she had, and also I've noticed that because she spoke second languages, Filipino and English. And, sometimes, she say things that was not really she meant. So healthcare literacy was definitely one of the biggest factors why I went there. And also not being there, and for me as well, and not knowing what that care looks like for her. And I got into this industry because I want to change and give back to the people, and people don't have to go through what I went through.
Okay.
I want to educate, support them, whatever I can, in ensuring that their loved one, or if they don't have anyone, that they have the support coming from me or my team. And that's really drawn me to this business. And of course, really giving back to the community and how we can shape the community, making sure that everybody's, people at home, aging in place, thrive well.
Yeah, a lot of what you just said resonates even with me, because I also come from a business background. I have two sisters that are both in healthcare. One's a physical therapist and the other one's a nurse. And when it came for our dad to start having dementia a couple of years ago, they didn't know all the resources. They didn't have all the answers. And it's interesting that I'm doing this podcast now, and it's just meeting and learning about all these resources and who the players are and who can do what. Because the funny thing is, even though my own sisters were in healthcare, they didn't know, they don't know half the things that I even know now. Now, a related question I have is, what led you to create Triage Home Health, and how is your approach different from other agencies out there?
Well, additionally to my background, I used to actually run multiple home health companies and home care companies. And I see large corporations tend to put everybody in the same box on their journey of aging.
Mhm.
For me, I didn't see that way. I wanted to make sure that everybody is respected and not put in a one box, but really respect them in different stages in their life, whatever they're going through. And, so that's that. So second part is having a knowledge in operations and business operations of all different multiple sector of home health and home care, hospice industry. And I've seen a lot of our providers either trained or there's no ongoing training, not recognized, and sometimes even exploited, not getting paid for what they deserve or the respect that they deserve. So I wanted to change that. Secondly, I wanted to create jobs. I wanted to make an opportunity and create a diverse of staff, employees that support the Bay Area. The Bay Area, of course, we're a melting pot of
Right.
different culture backgrounds. So I wanted to, and again, giving back to the community.
Got it. Now, what's the story behind the name Triage for your company?
So behind the name of triage is really about it's our turn now to provide care. Let us take it from here. And, that's the whole idea, is to make sure that we provide, whether it's we're talking to the family members or a referral source. And we assure them that we have the expert skilled care services and clinicians, whatever that is, that we can provide that care. And we would put in all the resources that they need and provide them the resources and open the door to get those resources put down. And how do we deliver that timely, right? And making sure the patient-centered care and quality is there. And so that's what, how I came up with the word triage, because at the hospital settings, usually if a person goes to the ER, they go to another different set of care, they triage it to a more specific type of services or care that the patient needs in the hospital. And that goes the same way. They can triage that patient to us based on that patient's needs.
Perfect. I know we have a lot of listeners, viewers that may be finding the show that are new to what the term home health means. Now, for families who are new to this, can you explain exactly what home health care covers and what it doesn't?
Yeah, home health is a variety of disciplines, skilled services, such as registered nurse, physical therapist, occupational therapist, speech therapist, social worker, a home health aide, and dietitian nutritionist. Those are the services that are being provided to people home when they're ready to get discharged from a hospital, or simply a person has a recent change of the behavior or conditions in the home that's related to or can be contributing to their chronic diseases. What I look for in a home health is really about having a competent staff and making sure that they are proficient in the healthcare industry. And this also takes a lot of coordination. So, the home health coordinates your care with your primary care physicians, anything that is related to your needs at home. Again, making sure that they're dedicated to your well-being and to ensure there's seamless care experiences there. But also the services are available on 24 hour. If you have questions or communication, care plan, whatever that is, home health is there for you. It can be readily accessible. And the visits are scheduled, where you don't have to call and make an appointment. We actually call you and ask you where would be the best time for us to come by and visit you.
Okay. Now, on my podcast already, I've had guests that were home care agencies and also have had guests that do hospice. You are my first guest that is talking about home health. How is home health different from home care or hospice?
Great question. I asked a lot of this. Home health goal helps patient recover and to make sure they thrive and stay well and healthy at home. That is, we focus on curative and rehab focused. We're also making sure the patient is seeking improvement or stability and to improve their condition.
Okay.
Again, like I said, the services will include the RN, PT, OT, MSW, dietitian, CNA. And the hospice is more geared towards the comfort care,
Okay.
non-curative, end of life, for patient with prognosis of 6 months or less to live. And then focus on symptom management, stops curative treatment, and they do have spiritual care, and including RN, chaplain, social worker, and home health aide as well, that regularly visits.
Okay, got it. I know typically home care is all non-medical and then home health is all medical, correct?
Correct. So home care is considered non-skilled, which is non-medical, and home health is non-skilled in medical services.
Right. Now, what kinds of services can a home health agency like yours provide for seniors after a hospital stay or surgery?
A lot. So usually after surgery, there's a couple things that we look at. We do an assessment, right? Basically every patient that we get referred to,
Okay.
my team and myself even go out to be part of the care, introduce ourselves to the patient prior to their discharge, be involved in their care conference,
Okay.
meeting with their case management team, director of nursing, their social worker, whoever's involved in that interdisciplinary team in that hospital settings. And our job is to understand that clinical side of their needs, but also understand the psychosocial needs that they need. So when we go home or we prepare for them to go home, we have all those services and ready for them. And at the same time, we forget that the human factor or human connections, you have to have that. We deal with a lot of patients. Sometimes they don't. A lot of times, actually, they don't have family members. They're themselves, and we try to do our best to assure them that we become their family. That you don't want to advocate for them.
Now, how does someone usually become eligible for home health services? For example, does it require a doctor's order?
Yes. So every person, whether, for example, if you're coming from the hospital, you do have to have a attending physician at that particular facility or hospital that would sign off on your needs based on the care plan before you go home. But if you're not coming out of the hospital because you're either your caregiver or your loved one, somebody thinks that there's a change of your condition, they can simply ask for call your primary care physicians, identify your struggles, whatever that is, whether it's you have a increased visit in an ER or hospital, you can't manage your medication, you have a lot of pain, or you have fallen a lot more than usual. Usually those are the telltale signs, and feel free to call your physicians and have them write that order. And, once that order, then they will contact a health company similar to us, and we will go ahead and do an assessment, evaluate your needs, and communicate that with our primary care physician, and then establish a care plan that will allow you to stay healthy and probably at home.
Okay. I want to pivot to how it works from the transition from hospital to home. I know hospital discharges can be confusing for families.
Yeah.
How does Triage Home Health help families navigate that critical transition?
Oh, man. There's a lot of play into this. And I understand. I mean, we work with a lot of family and patients.
Yeah.
And they get lost in the transitions.
Yeah.
Because of lacking know-how, fear.
Yeah.
Of not knowing what to do when they get home.
Yeah.
Or being alone or not having the support. What we offer is really, again, assessments in ensuring we understand the whole big scope of care needs
Yeah.
by making sure that the continuity of care after the discharge
Okay.
is put together, and that there will be an oversight, and that right away, technically by law, by home health Medicare guideline, we have to start them within the next 24, 48 hours once we agree that we're going to service the patient. We can then schedule the skilled therapist provided, whether it is focused on wound care management, medication management, or simply as learning how to use a walker or
Okay.
learning how to use a new bed, a hospital bed. Focus on patient advocacy.
Okay.
And that's super important, and what that looks like. Communicating with the doctors, the hospitals back, reporting them, letting them know how they're doing.
Yeah.
The care coordination, simple as home safety checks, eval. Is there a safe discharge at home? How's the home look like? I've gone through a lot of different homes, and I've seen homes that are, trust me, it's not safe.
Yeah.
And ensure that their established care plan that would prevent unnecessary ER visits. And make and ensure that home health, the impact is that the patient will receive a similar service hospital level care at home for faster recovery, and really to making sure that we're supporting them in their long-term wellness goals through patient and caregiver education, chronic disease management, whatever it is that they need to stay well and healthy.
Perfect. What are some common mistakes you see families make during this transition, and how can they avoid them?
Mistakes, or a lot of the time I've seen not getting involved,
Okay.
not asking questions, or don't know what to ask, what kind of help to ask for. And I just want to remind the audiences and the community, seek out a person like you, like me, and ask for assistance. It's okay. Nothing wrong with that. You can use AI today to learn more, but not getting involved in the care conferences and not asking the right questions. Usually those are the big common mistakes, and not being prepared.
Mm-hmm.
Do some homework.
Nice. How important is early planning while still in the hospital versus waiting until the last minute?
Oh, huge, super important. This can really determine your outcome and the service that you will receive in making sure that you're prepared. Because you get to choose,
Okay.
don't, a lot of people, I'm not going to go back to the mistakes, when not prepared and not doing your research,
Yeah.
you have options. Patient, family have options. You are to be given 3 options and to make a decision and to interview those resources. And it's up to you to make the decisions and from there on. And usually, when you make a decision, it's about who you think you can trust, who you can connect, that human connection that will empathize in your needs, not just having you become just a number or a person to visit and then we're on our way.
I know everybody situation is different now. How do you tailor care plans to fit each senior's unique medical or personal needs?
Really, it's about assessments,
Okay.
reviewing all the documents, and the rainbow of chronic conditions they have. I call it rainbow. Not many people have just one chronic disease that they have to manage on their own, but many people have a combination of that, with different combination. But understanding that and what that looks like, and what the care looks like for that, and then ensuring that assessment is there, that we have a experienced clinician that would work with your doctor to find treat, and then including the education of that and what that looks like, and then making sure that the personal care are involved, whether it's you're by yourself providing care or having a caregiver, or you live in a facility, that making sure that that communication is established and that education is that they know what that looks like. Going back to emotional support.
Okay.
Social isolation is real. companionship, the empathy. Getting sick is not fun, and sometimes you make irrational decisions. And that's what we put social worker in that. Every clinician that is needed, every resources that's available to you, we want to make sure that you know that you have access to that. So that will kind of support that person's need and understand also the direction of where they're coming from whether it's a hospital settings or skilled nursing facility or rehab facility, whatever that is, and understand the current progress notes they have and the discharge notes that they have and make sure that we implement all that.
Okay. Now, for my next question, you talked about this a little bit, but I want to get even more detail. What kinds of specialists are typically involved in a home health team? Nurses, therapists, social workers, etc.
A lot of our clinicians will have, actually in my team, I can speak for my companies and my team that I put together. This is the fun part of having your own company. You get to select a group of people that you trust.
Yeah.
In this industry. One of my clinical manager, who's my partner, he's got 20 plus years at one of the largest local hospital today. And so he's got plus 20 plus years. And I work with nurses that we just recruited who I've been working with over the past 12 years, who is a director of nursing at a facility, skilled nursing facility, a hospital setting, who understand, what that rehab look like. And now she's working with us to home, have licensed LVNs that used to be home health aid and now can practice clinical services, who understand the caregiving needs, ADLs, and now can perform the high ADLs, activity of daily living, not just further from bathing and showering, grooming, but really understand what that looks like and the frequency of that, right? A lot of our clinicians and social workers, of course, they're licensed social workers, and these are experts in their field, include the physical therapists and occupational therapists. These are people that are expert in their fields. They love what they do, and they care about the well-being of our clients and our patients, and then ensuring that they're safe at home.
Okay. How often does a care plan get reassessed or updated?
Great question. That's important. Those are established at the actually start of care.
Okay.
We have case management, the RN that does visits, the initial visits. They're the one who will initiate, coordinate that care based on their needs, that particular moment that they need it, whether it's twice a week, every visits, and it depends on the frequency of visits. And also that will be coordinated with the doctor. That's when we do our evaluation as every visit that we do, whether it is we do an RN visits or just a follow-up visit, PT visits, home health aid visits. Everybody have their own assessments and notes that they share with our director of patient care services. And our job is to look at that and make sure understand what that looks like and that person's the path to recovery.
Okay, got it. Now, you're a lot of times communicating with the family, the adult children, I'm sure, with progress. So how do you keep families in the loop about a senior's progress or any concerns?
We use technologies.
Okay.
I love technologies. Privacy, my background is tech.
Yep.
We use apps that our care providers, can instantly could give us notes and they get back to us. So when a family member calls us for what the care looks like, we can share them. HIPAA compliant, of course, via text, via phone call. We have 800 number that they can call 24/7.
Okay.
And again, we love people, their family members, caregivers to call us all the time and asking the progress and what that looks like and what is the next steps. Or how can we prevent these? And about, also being involved in the plan of care of that person, of their loved ones. We use platforms like that.
Okay, excellent. Now, in your experience, what's the biggest risk seniors face when transitioning home without proper home health support?
No caregivers. No oversights.
Okay.
As much as we trust them and as much as the person who can be independent at home, I think the first 30 days are very crucial upon discharge. because there's a lot of things that goes on from managing coordination, just the coordination of the care, speaking with your doctor, pharmacy, your medical equipments, your transportation, social services and psychosocial services that you would need. A person just got in the hospital, they imagine they've been in the hospital for 17 days on average, and they got that, round the clock services, right? And now imagine them going home with no one. What would that look like? We found out that data with that home health is that they have a likelihood that they will go back to the hospital within the next 2 to 3 days.
Okay.
The admission rate is so high in CMS tracks this, Medicare.gov tracks this. The average readmission rates in California and nationally actually is about 11%.
Oh, wow.
Yeah, and we want to, the healthcare system with the hospitals and all of us, we want to focus on target on lessening, and really, we have to identify what that looks like.
Okay.
We understand what that looks.
Okay. What role does home safety modification, grab bars, ramps, fall prevention play in successful aging at home?
Huge. A lot of the related deaths happens because of falls.
Okay.
And that's scary. Having somebody to go out to do a safety eval, understanding what the home, creating a home safe environment, it makes a big difference. It's not really, there's a couple of things that you focus on when you do the home safety eval. Of course, grab bars is important. The ramps are important.
Okay.
But also how they're managing their medication. We have an opioid crisis in the United States. It's huge, right?
Right.
And a lot of the time I've noticed, and a lot of people notice that we discuss this in the hospital system, is that, patients get a new list of medication, whether it's 2 to 56 medication.
Yeah.
To imagine a person just got out of the hospital, how do you manage 56 medications, right? And then what do you do with the medications you currently have today? That your doctor or that doctor that signed you off say you cannot drink anymore because there's new medication, there's new dosage that you have to manage now. Right? So those are the part that we include in our home safety eval.
Okay. Now, how does having a strong home health team impact a senior's ability to avoid rehospitalization?
Oh my God, it's super important. The home health company should hold, my drive, I can't speak for them, but I can speak for mine.
Yeah.
It's always making sure that we are patient-driven and family-driven support system. Our clinician is really the one that sets a reasonable and achievable goal in ensuring that, and we encourage our patients to get well through education. And at the same time, finding a way to provide them that emotional support. Again, humanizing the services, which sometimes it's not, sure, the treatment, it makes a big difference, but really humanizing the emotional support, empathizing and understanding, and just simply being there for that patient makes a big difference.
Okay.
Yeah, and then another way that we add to that is really making sure that we have efficient tools for our clinicians when we go out there. I don't know if the average, the CMS just came out with the data just recently, the average home health visits in the home is 35 minutes to 52 minutes. So imagine 30 minutes. What can you do in 30 minutes when you have, I can attest you, there's about 36 or plus or minus just consent form that a patient signs. How fast can you read a consent form, which is like multiple pages of 10 fonts, right? We changed that font even actually to 12 fonts so they can even read it. Those are the minimal requirement. I actually able to make sure that we make that larger. But, imagine as a clinician, and this is the biggest issue too, right? That people, our team is so focused on the documentation
Yeah.
And documentation takes about 65% of that, right? And how can we minimize that by making sure that we allocate enough time per treatment? So a good home health company will find out different ways to ensure technology is used. You train the person how to really provide a better treatment by ensuring that we spend that care time when it's needed the most.
Let's segue into some myths and misconceptions about home health. First question here is, what's one of the biggest myths families believe about home health services?
It's expensive.
Mm-hmm.
In fact, if you have Medicare, it's 100% covered. The other myth is home health does not provide you similar care services at hospital settings. When not true, because like I mentioned earlier, a lot of our clinicians are licensed, and we actually tailored the services to that person's specific needs based on their chronic conditions and how we manage that, from medication management to wound. And it's delivered at home without having you to go to the hospital or go to a doctor, right?
Yeah.
And all the care coordination, whether you need more medication, you have a nurse that can actually help you get that rapidly, quickly, communicate that with your doctor. How many people experience, right, that reaching out to their doctor or their primary care provider, whatever that is, it takes them a while. So
Yeah.
imagine you have that visits from our home health company. Another, thing is that couple of myths that they say is the home health provided around the clock.
Okay.
This is the part of the second thing that you brought up earlier. What's the difference between home health and home care? I get these questions a lot. And will Medicare pay for home care? Right. We know we established earlier that home health is 100% covered by Medicare, but home care is not covered by Medicare.
Mm-hmm.
And home health is not provided around the clock. These visits have to be pre-approved by your primary care physicians and has to be approved by your insurance provider. That is how it's determined. And of course, if you can pay out of pocket, we can put more visits to you. It's great because we have patients that they love to have more tailored care clinicians and that they like to see, and they're willing to pay out of pocket. Can do them.
Okay. Now, some families worry about losing independence when care comes into the home. What would you say to those families?
It's mostly not family are worried. Actually, is the person that are receiving the care is worried that their independence is being taken away. That's where we come in and really have them understand what that care looks like. Get them involved in the decision process of making and what the care they should receive and what's important to them. How come help us set expectation, right? And how can we create a happy medium with the care plan that will help them thrive versus what their expectations are? And then, create a more achievable goal, an attainable goal that they can do and participate. Most importantly, is participation. And get them to understand and get them to buy-in of that. And then ensuring the family supports that. And I've seen this time and time again, that family member, they think they know what their mom and dad needs. Because sometimes they think mom is not there cognitively, or they think they're making some erratic decisions, or whatever that is, that they feel like they have to make that decision on their own to make sure that mom gets stuff care. Not necessarily, sometimes as a family member, you have to talk with them and talk to your parents and ask them what's important to them. And sometimes we forget that. And that's what the fear was of losing independence. But if we can say, mom, dad, we are partnering with XYZ company and different people to create you an environment that's where you're going to be safe and you're going to be thrive and you're going to stay healthy. How does that look like for you? And this is what that looks like.
Nice. Nice in painting that picture, right? Alvin, I love hearing stories. I love hearing success stories from the guests I bring on for the work that they're doing. Can you share a memorable success story where home health made a huge difference in someone's recovery or quality of life?
Yeah. Great. I mean, these are great questions, by the way. Um, I can share 1,000 stories, but I can, one of the most stories that I can remember right now is we had a patient right down the street where I live
Okay.
in Pleasanton. I was called just to, because this person had I got a call around 3 p.m.
Okay.
and, but she fell around 8 a.m. She got out of bed, tried to get in the shower, slipped and fell. She tried to pull she lives in the community. She tried to pull the alarm, didn't work. No one saw her. But thankfully, she was able to manage to crawl like army style on the
Huh.
floor. And it took her about close to 6, 7 hours to get to the door
Okay.
from her bathroom, master bedroom to the bathroom, and be able to open the door. Thankfully, her door is, has that latch that you can just pull down and she screamed for help. So I was called. So the community found her on the floor. I got there. She was dreaded in blood. I noticed some, bruising in her head, but she was scratchable because she was falling.
Yeah.
And we were able to manage to get her up. ER was there, and she said, "No, I'm fine. Everybody can do it." Yeah. I knew for some reason I had a hunch. Usually I go with a hunch, and and I don't want to leave her. I said,
Yeah.
"Look, is it okay if I call? I'm going to call you. We already called her family number, but is it okay? I just don't feel leaving you like by yourself, friend.
Yeah.
Can I take you to our local hospital? Okay, I promise I'll stay with you." And
Yeah.
this is, by the way, Christmas Eve, by the way.
Oh, wow.
Oh, excuse me, New Year,
Um,
Thanksgiving Eve,
Yeah.
right? So because it was an emergency, everybody's closed, and I was happy to be one of the vendors that they called. So anyway, I got there, put it in my car, drove down. Luckily, the house was down the street, the local hospital down there. I realized I entered to the ER and describe what happened. And I asked her family member, I asked, "Hey, is it okay? I can't be here, but I can provide you my caregiver that can be here so you feel more confident." And she agreed that we would have a caregiver for her stay right next to the bed. Sure enough, fast forward, while she was in the ER, she went through a CAT scan, CT scan. They didn't find anything. They were ready to go home. Family got a call, and I happened to be, those hotline, they know me well there. I said, "Can you please run it again?
Mm-hmm.
And can you do another CAT scan? Can you do another X-ray?" As because feel something.
Yeah.
Sure enough, so they kept her. And then right away, 2 days later, they found out she had an internal bleed on her brain. So she was admitted to the hospital. She was there about a month to recover from. And I got a call again, "Hey, XYZ, Miss XYZ is coming home. Hey, she wanted you to follow her home." Yeah. So,
Yeah.
yeah, she's like, I like him. He's the only guy I trust. He know what I want. He knows what to do when I need it. I don't have to ask. He just know. Yeah. And fast forward, and she was with us for about a couple of years.
Okay.
We were able to help her identify needs, coordinate things that she needs at home to make sure that she's well. And yeah, it was one of those experiences that I will never forget. It's you really, in this business, I assure you, it's like you can't be halfway foot in the door.
Mm-hmm.
You really have to be 100% in the door and through the door, and
Yeah.
making sure that we don't have to know everything.
Yeah.
It's okay. We're not going to be an expert. The good news is we're surrounded with people who's an expert in different areas. And we just have to make sure that we know how to utilize them, right? And how they can help us and the people that we serve. And that's super, super important to me. And that's why one of the biggest thing is really giving back to community, to education. You don't have to use our services. It's okay.
Yeah.
But the knowledge and education is there for you. It's free. Ask for it, and you shall receive.
Yeah. And a great intuition that you had and just trusting your gut too. I think a lot of people just also in these types of situations really trust how you're feeling inside, because that's a good, like a compass of what you should be doing, for that loved one. Great story. Thank you for sharing that with me. What's one thing you wish more families understood about the value of home health services?
The services that can be provided, that is really tailored to the entirety of the persons who will be in and without slide. I really understand what RN responsibilities and duties and job roles and what they're capable of from social workers, what they can do. The social work is underutilized, if you ask me. Many people just think that they just need it for emotional support. In fact, social work are there to help a person or family navigate through the complexity of getting assistance from the state, from locally, from federal government to insurances. That person can help open the door and guide you to get there. Mm-hmm. And those are underutilized. I encourage people to use that more. And not just more, these are to improve your psychosocial needs, right?
Yeah.
Home health aid is also not utilized well. A lot of people cannot afford full care. They cannot. Imagine, again, we based on our experiences, we know that why people they go to the hospital more often because they forget to shower, they forget to brush their teeth. Imagine, I like to shower, you like to shower, I like to shower 1 to 2 times a day. Imagine you don't shower for 3-4 days, or because you forgot that you forgot that you peed, you forgot, you have an accident on yourself and you're in bed and or you just good night, you just don't look it up because you're afraid of falling. Mm-hmm. So having a home health aid visit, check those regularly, keep you fresh and healthy, really keeps you up at the Hawkesbury. It prevents you from getting UTI, urinary tract infections. Yeah. And those are super, super important in really making sure to keep you out of the hospital, keeping you clean, brushing your teeth regularly, and making sure you look good, you feel good, right?
Right.
Those are super, super important. I know people say, I'm just home. I'm just going to wear my PJs. I like my water PJs or whatever, my nighter PJs. I don't have to impress anyone, and that's why home health aid is super important. Caregivers is important to encourage that. You don't have to wear what you wear by going to bed all day long. Mm-hmm. That's because if you feel good, you look good, you feel good, you do good, and plus it's also safer too when you do your exercises, right? Yeah. So there's a lot of components behind it, and really ensuring that you're pricing those services is super, super, and understand what that looks like is super important.
Yeah. I have a question because you're from a tech background. Are there any new technologies or innovations you're excited about that could change how seniors receive care at home?
Yeah, I actually, Tesla's under a lot of fire right now, right? I love their robotics, the robots AI that they demoed a couple months ago this year, that you can program it. I think that would be ideal. I'm actually trying to entertain them getting one and experiment with one in providing that ADL support at home or just having a companionship. That I'm excited about. Remote patient monitoring, RPMs, devices that he can take to home, like blood pressure monitor, temperature, oximeter, things like that, can provide real-time data, and that can be sent to the primary care physicians right away rather than just written on a piece of paper. I'm excited with the EMRs, electronic medical records, today.
Okay.
They're ever changing and ever evolving. There's a lot of good companies out there. There's great companies out there that really embrace what's the needs of a lot of companies today, and how those data is being utilized by, improving the algorithms, data reporting. That is really geared to patient-centered care.
Okay.
and also clinical engagement, and how is the clinical clinician team utilizing that on the field in ensuring that efficiency is delivered, equality is provided. So those are I'm excited about.
Yeah.
Yeah, there and then the virtual continue to do virtual telehealth. Those are super important because a lot of our patients are homebound. You qualify for home health, you have to be homebound. So telehealth, video conferencing like this is super, super important. Having multiple platforms using Zoom, Google Chat, whatever out there is readily available. And it's key. As far as data, your technology that you would use out there, you have to have a backup from just the regular providers. What other service that we can use in order to provide the continuity of services that is provided to home by making sure that we use different providers to make sure that we have internet access. So we rely a lot on that. So those are super important to us.
Okay. One of my last questions for you is, for seniors who are healthy today but want to plan for the future, what steps would you recommend for them now?
Well, again, I love your questions, and this is very cool questions. Plan, emotionally plan, financially, medically plan. Identify who will assist you, who's going to make a decision on your care decisions, and versus a person who's going to make a decision on your financial needs and how is that being spent. Thirdly, is finding another person, assign somebody who can help you research the services out there that you can utilize. And the fourth is who also will be there for you. That making sure that when that rain comes, you have an umbrella, right? And you have all those pillars that's going to help you stay well and healthy at home and get better. Also, one other thing I suggest, a lot of our older community, they're losing their friends. They lose their friends every so often. Time I go on assessment, I used to have lyrics to, for example, used to be here, but she passed. So a lot of their circle of friends are becoming from 15 to 20 to 15 to 10 to 12 to 1, whatever.
Yeah.
Now almost zero. I encourage them to build new social circle, new surroundings, and it's okay. Go out to the community, make new friends, talk to the young people. One of my biggest projects is actually how do I bridge the gap? We're a Gen X, right? We are, right? My kids I have a millennial and I have a Gen Z.
Yeah.
And my biggest project today is how do I lay the Gen Z, and the millennial to my care needs when that happens. So if you ask, if you ask my daughter today, or someone's daughter today, or sons today, and if I get sick, do you know where to start?
Right.
So those are the things that we're changing. This is why we have volunteer systems that I implemented in our company to talk to people in school who wants to be in healthcare, who doesn't need to be in healthcare, just want to be involved in the day-to-day operations. So whether it's, whatever they want to decide eventually, I get them involved and we teach them what that care looked like. Yeah. So, sometimes you just take one to educate one, and then when they're on, that person can multiply to 100. So, yeah. And so, again, we have to continue to evolve on how to pass down this knowledges and make sure that these care is available and that needs can be fulfilled, and so they can help the future generation.
I like that. I love that. Thank you. Any final words? And also, I didn't ask you this in the beginning, but I wanted to make sure everybody knows what geographic area you were able to cover, and also how can somebody get in touch with you if they want to work with you?
So we cover Of course, my neighborhood, which is the Alameda Contra Costa neighborhood. And we service as far as Santa Cruz County,
Okay.
Santa Clara County, all the way down to Marin County. Then jump to, we covered Alameda and Contra Costa, and then we go to Stanislaus on King County, Fresno, all the way up to Dow County.
Okay. Perfect.
And how to get a hold of me, I have a website called mytriagehh.com, or they can call me on my phone, 510-825-7571, or they can email me, Alvin at mytriagehh.com. Very simple.
Perfect. Alvin, thank you so much for joining me today and giving us such a powerful look into the inside world of home health. It's clear that you and your team at Triage Home Health are committed to helping seniors thrive, not just survive at home. And your compassion and knowledge really shine through, and I'm grateful for the work that you do. And for those of you tuning in, if your loved one is considering senior living and you need to figure out what to do with their home, let's talk. Schedule a free consultation with me by clicking on the Calendly link in the description box below. Learn more about my services at www.simplifyseniortransitions.com. Have a quick question, DM me on Instagram at SoulByDale. And hey, if this episode helped you, please leave a 5-star review on Apple Podcasts or Spotify. It helps more families like yours discover the show. And don't forget to share this episode with someone you know who might need it. Thanks again, everyone, for listening or watching. Alvin, one last thank you for being on the episode today. And I'll see you all on the next episode of the Simplify Senior Transitions podcast.